When we look at a dental practice, we look at lots of different reports from Open Dental. But I wanted to show you kind of quick and dirty where we always start and where you should always start in trying to assess the health of your practice. So these graphic reports are built into Open Dental. Open Dental generates a new set of graphs the first of each month. And you get there by simply going to Reports and then clicking on Graphics. We always want to look at the production, income, accounts receivable, and new patients. These are the four most important things to check as far as the health of the practice is concerned, and then we can drill down from there depending upon what we find here. So let's take a look at this practice. You can see that the production and the income are about the same. Okay, well that should be good, except this is often misleading because this is a net production. This is a production after any adjustments were made. And if I want to show really good 100% collections, all I have to do is adjust off anything I didn't collect. So if I produced 150,000 and only collected 100, I can go in and do an adjustment for $50,000 and it looks like I collected 100%. So you have to look at more than just these two things. But it's important to look at these two things, but kind of keep that in mind. On the lower left, you can see the accounts receivable are about 1/2 of the average monthly production. That's good. That's where we'd like to see it. You can get a little bit lower than that, but that's a good number. On the lower right, if you look at the number of new patients, this practice gets a whole bunch of new patients. We'd like to see about 30 new patients per doctor in the practice to have a healthy practice. But overall, looking at this practice, it's doing very well. The AR is pretty low. We want to always check that. And the production and the income are doing pretty well. And the new patients are doing very well. Let's look at another practice. This practice is not so hot. Okay, the first thing that you see is a very erratic production and income. Remember in the previous practice there were variations, but they were relatively smooth. If you look at the production for September, it kind of fell off a cliff there too. So not only is it all up and down, but he kind of fell off a cliff in September. So that's not good. And the same with the income. Okay, like the previous practice, the income and the production are roughly equivalent. But again, that can be misleading. Look at the accounts receivable though. The accounts receivable, $65,000 roughly, and this practice is averaging $45,000 a month, just kind of eyeballing that. So this is maybe 1 1/3 of 1 month's production. That's too high. At the most, 1 month production. So this practice, and you can see the accounts receivable has been trending up too. That's not a good sign. So we got some concerns there. We want to look at those accounts receivable, and we want to look at why the production's jumping around. Okay, let's look at new patients. That's one of the problems with production, is this practice is not seeing enough new patients, and the number of new patients is declining. So again, we'd like to see on average 30 new patients a month per doctor, and this practice is only getting 12 or 15. How about this practice? Now I switched, I got production and income over where income was over on the right last time, and now it's down here. But again, not producing very much, but according to this, they're collecting what they're producing. If we look at the number of new patients, kind of like the last practice, not really getting enough new patients. 18 new patients, then that's kind of high. They're usually getting 15 to 18 new patients. That's not enough to sustain a practice over time. The other problem with this practice is the level of the income. $24,000 a month really is not enough to sustain most practices. And as a matter of fact, this practice is really having cash flow problems. It depends. Even with a very low overhead practice, though, it's very hard to show any profit at all when you're only producing and collecting $24,000 a month. And that was the problem with the previous practice also. But the big problem is the accounts receivable. The accounts receivable is close to $400,000 on production of $24,000. So what's that? Roughly 15 times monthly average production. So that's the number that you, in this case, that's where we want to drill down and see what's going on. If your accounts receivable is more than 1 month's production, that's something you want to drill down and concentrate on. If I had to zero in on one thing to look at for the health of a practice, and dentists sort of intuitively know this, and that's income. Everything else feeds into income, but the single most important thing to look at is the number of dollars that are coming into the practice each month, because those are the dollars that you have to spend on the overhead. So this is sort of the bottom of the heap here of what's important. Everything else feeds into the income, and this is the thing that you want to see go up over time. If you're working with a consultant, including us, and your income is not going up over time, then you need to make some changes. Maybe change the consultant, maybe change the way you're trying to execute what the consultant is showing you. But the whole purpose of consulting is to have your income go up over time. So can we as consultants take one of those two practices at the top and turn it into the practice at the bottom? No. And any consultant who tells you that they can do that, I think, is fibbing to you. What we can do is help you install systems and coach the staff to use the systems that will allow you to create the practice on the lower right. You need a combination of effective office systems combined with an effective practice management software such as Open Dental, and a motivated and trained staff in order to create a practice that is profitable and provides the best level of patient care. So I think every doctor should look at those 4 graphs in Open Dental every month to kind of get an idea of how well the practice is doing and also how the practice is progressing over time. Especially keep an eye on the income. Hopefully this is helpful for you.